Castle Point and Rochford Health and Wellbeing Strategy Reset, Ageing Well Workshop from the 9th of September 2020, facilitated by Nancy Smith, who is the Commissioning Manager for Dementia and Older People's Mental Health Southend, Castle Point and Rochford. Ageing well. What do we know? Older people are more likely to live with multiple and complex long-term conditions or with frailty or dementia. The older you are, the more activity you need. The more long-term conditions you have, the more activity you need. Ageing well. Considerations for today. Frailty, including falls and fractures and long-term conditions. Dementia. Older people's mental health. And excess winter deaths. Questions to consider as you look at the data. 1. What does the data tell us? 2. What are the key themes identified? 3. What additional issues or effects has COVID-19 had on ageing well, and how might that differ from what we see here? Life expectancy versus healthy life expectancy. According to government data, life expectancy at birth is 80 years for males and 83 years for females in Castle Point. In Rochford, life expectancy at birth is 81.4 years for males and 84.4 years for females. However, health inequalities mean that some people will spend more years of their lives in poor health than others. The difference in life expectancy between the most and least deprived areas of Castle Point is 5 years for males and 4.8 years for females, whereas in Rochford, the difference in life expectancy is higher for females at 4.1 years and 3.3 years for males between the most and least deprived areas. This data was obtained from PHE fingertips. Falls and hip fractures. The 2019 JSNA profiles state that Castle Point and Rochford had the second and third highest rates of emergency hospital admissions due to falls in people over 65 across the Essex district. Castle Point had 2,362.11 per 100,000 population, and Rochford had 2,258.51 per 100,000 population. The highest was Basildon, with 2,677.10, the lowest was Harlow with 1,742.48. Both are higher than the rate across Essex, which was 2,059.46, and England, which was 2,170.43. Basildon, Castle Point and Rochford were the only districts in Essex with a higher rate than England. The age standardised rate of emergency hospital admissions due to hip fractures among over 65 was lower than the rate across Essex as a whole, which was 611.9. However, both Castle Point and Rochford had rates that were higher than England, which was 577.76, with 588.79 and 607.61. This is the 2017-18 data from the hospital episode statistics. The figures stated are age standardised rates of emergency hospital admissions due to falls and hip fractures. Values given are per 100,000 population. Physical activity in older adults 75 plus. The latest comparable data from Sports England's Active Lives survey shows that 56.4% of adults in Castle Point and 49.5% in Rochford are inactive. This means doing less than 30 minutes of physical activity a day. We have been monitoring the impact of COVID-19 on physical, cognitive and emotional well-being across South East Essex from the start of lockdown and have seen considerable deterioration across older people. We have also seen considerable deterioration in residents of care homes, causing upset to visiting families. Numbers of people referred for the falls prevention programme in Castle Point and Rochford in the last year are not available, but the future is hopeful. Physical activity opportunities since March. At the start of lockdown, many organisations shifted their mode of delivery to online, offering a range of virtual activity sessions. Active Essex launched a YouTube channel called Keep Essex Active, with a weekly timetable of activities for people of all ages. Sport for Confidence occupational therapists and sport coaches delivered sessions on Zoom to offer specialist support at home. Some group face-to-face sessions have since resumed where possible, such as the Action for Family Carers Feeling Good Caring Well, Wellbeing Walks for Carers. Dementia figures. Compared to pre-COVID figures recorded in February, the latest figures from July show that the number of people recorded with dementia in Castle Point and Rochford has decreased from 1,836 to 1,780. Meanwhile, the estimated number of people with dementia has increased from 2,828 to 2,849. The number of people being supported has also increased from 972 to 1,266. The percentage recorded in February was 64.9% and in July was 62.5%, both of which are below the NHS England target of 66.7%. For Southend, a total of 1,764 people were recorded in July and 2,386 estimated, compared to 1,909 recorded and 2,405 estimated to have dementia in February. Across the whole of the Mid and South Essex area, the percentage recorded has dropped from 65.8% in February to 61.8% in July. This is the same as the national picture, with 63.2% of over 65s thought to have dementia in July, compared to 67.6% in February. Nancy Smith commented on this, saying, "We have put a lot of effort into continue to diagnose people remotely in ways that are safe and acceptable to people, but completely different to what they are used to." Projections. According to the Projecting Older People's Population Information, the number of people in Castle Point and Rochford with dementia aged 65 and over is projected to increase by 46% by the year 2035. Although the number of people under 65 with dementia is projected to stay the same at around 50 people in Castle Point and Rochford combined, how much can we rely on these figures is probably somewhat debatable. It also doesn't take into account people with mild cognitive impairment who might be on the register as well. Louisa Moss commented on this data, saying, "We need to be mindful of statistics as they are going to be a lot bigger than those shown here." Spencer Dinnish commented on the dementia data, saying, "When talking about dementia, we only talk about the over 65s, but it is important to support all ages." Older people's mental health. 20% of those living in a community and 40% of those living in a care home have depression. Numbers using improved access to psychology therapies is 138 since April, with the biggest increase in July and August. Some of the particular problems for older people experiencing depression are as follows. Physical symptoms and depression. Some physical illnesses can give you symptoms that are similar to those in depression. For example, loss of appetite or poor sleep can be caused by thyroid problems, heart disease, or arthritis. Long-term illness. If you become depressed, you may start to get more upset by your health, even though it hasn't really changed for the worse. Treating the depression can't take away any physical health problems, but it can make them much more bearable. Confusion and memory problems. Depression, worry and anxiety can affect your memory and make you feel confused. You may worry that you are suffering from dementia when it is actually just depression. A new sense of loneliness. Living alone does not automatically make you depressed, but feeling more lonely for no obvious reason may be a sign of depression. Depression in older people can be caused by physical health problems and long-term conditions, low mood and memory problems, feeling less interested in everyday activities, declining social invitations and bereavement. For carers, isolation and loneliness exacerbates the feelings of depression and anxiety. Excess winter deaths. Excess winter deaths are defined as the excess winter deaths measured as the ratio of extra deaths from all causes that occur in the winter months compared with expected number of deaths based on the average of the number of non-winter deaths expressed as a percentage. Government data from 2017 to 18 shows that excess winter deaths are higher in Castle Point at 43 and Rochford at 45.3 than the England and East of England values. The excess winter deaths index for people aged 85 plus is higher in Rochford at 76 compared to 43.4 in Castle Point. Both areas are higher than the England and East of England values. According to the Office of National Statistics, colder than average temperatures for the winter months of 2017 to 2018 may partially explain the increase in winter deaths. However, previous years demonstrate a weak relationship between temperature and excess winter deaths. Increased excess winter deaths are not always coupled with unusually cold winters, and conversely winters with decreased excess winter deaths are not always coupled with milder winter temperatures indicating factors other than temperature, such as influenza, are also relevant in explaining trends in excess winter mortality. Winter worries. The following are worries that have come to our attention when thinking about the effect of winter: flu season, longer darker evenings, cognitive decline, falls, emotional decline, isolation, loneliness, depression, anxiety, second wave of COVID, lockdown and associated problems, lack or loss of community services and opportunities, mental health, and family and friends. Other factors to consider are wider determinants of health, deprivation, housing conditions, fuel poverty, barriers that may present challenges but also opportunities, and direct and indirect effects of COVID-19. Questions and considerations. What does the data tell us? What are the key themes identified? What additional issues or effects has COVID-19 had on ageing well, and how might that differ from what we see here? How can we improve access to services for older people? Sue Murray commented on that, saying, "COVID has changed what people thought was going to be their lives." She also commented in this discussion, saying, "We have seen a huge reduction in the number of people coming to us for debt advice." Nancy Smith suggested that we need to acknowledge the number of older people with debt problems, while Louisa Moss believes we need to personalise things even more. It's not as simple as asking for one thing. Next steps. What other data do we need to have to inform and provide more insight? Who else needs to be involved? We will be meeting as a subgroup before the December board meeting to continue discussion and develop the narrative around this priority and start thinking about some actions. How are we tackling the problems, and what other actions would help us to address them in terms of early intervention and prevention? Councillor Julie Gooding commented that the Hub has proven that we can all work together. Sue Murray added that partnership work has become essential and suggested we need to give an holistic approach.